When you walk, when you fundraise, you fuel our research, and you fuel the hope that comes along with that research. Hope for more survivors, hope for more time with the people we love, hope for less harmful treatments, hope for a cure. Big hello for the Brain Cancer Walk 2022. My name is Dr. Charles Cobbs, and I'm the director of the Ivy Center here at Swedish. I really wish we could all be here together walking at the Space Needle, but this year, unfortunately, we're going to do it again virtually. By the way, I'd like to give a little bit of history about how the Brain Cancer Walk has evolved. It was started by my predecessor, Dr. Greg Foltz, in 2008, so this is the 15th anniversary of the Brain Cancer Walk. It was a vision Greg had to get the community support together for patients and their family members.
It just feels like yesterday Dr. Foltz had this idea to do this. And it just shows the great support we've had from the community that we've been able to keep it going this long.
An amazing show of support for brain cancer. Since that time, I think we've accomplished a whole lot here at Swedish and throughout the community. Some of the accomplishments by Dr. Foltz and Ralph Puchowski, who's still here in the lab, include mapping out the biology of brain cancers through a brain cancer website with the Paul Allen Institute. Now that's been used by over 400 investigators around the world.
So the goal of the Ivy Center Research Lab is to understand the biology of brain tumors and how to develop our findings into clinical trials for brain cancer patients.
We continue to push forward a high throughput drug screening clinical trial for patients, and we've just about completed the phase 1, and we've gotten approval to move on to a bigger study for upfront glioblastoma.
We're very excited about taking that to the next level, which is launching a similar trial but for newly diagnosed glioblastoma patients so that they're able to receive a personalized therapy close after tumor resection.
We're trying to understand the biology of immunotherapy for glioblastomas.
That means that we're going to use antibodies or immune cells
to target the tumors, to eradicate the tumors without any side effects using the immune system.
And I would say immunotherapy is training the immune system from this patient to find the tumor cells and kill them directly by its own arsenal.
So I'm thoroughly excited about what's going on here at the Ivy Center. We'd be happy to give tours to people in the future if they're interested in more information. But for today, I just wanted to encourage everyone to get out, show pictures, contact your friends, and support the Brain Cancer Walk virtually because it's our 15th anniversary and we've accomplished so much, and it wouldn't have been possible without wonderful supporters like you all.
The walk is an amazing event because it is so supportive.
In that it provides encouragement of friends, family, people that you may not even know that you see are out there supporting the research that the Swedish Foundation is pursuing.
It's unfathomable how much support people need, and so I walk for those that can't walk and for those that are walking with me.
It's to remember Gary, my husband, and the remarkable Dr. Foltz.
This walk started as a way for me to cope with losing my sister. She passed away January 2017.
We walk in honor of my daughter, Laura. She was diagnosed in 2005.
I felt like I needed to have a way to honor her and also make myself feel like I'm making a difference so no other families have to go through it, because my sister Julie was amazing. I know there's other families that are missing out on loved ones because of this.
Brain cancer is a very isolating disease.
It's just a good feeling to not be by yourself. Go where there are other people who have experienced the same thing that we have.
It's a pretty amazing group of people that you are afforded to interact with.
I am continually eager to support Dr. Cobbs in this goal of advancing the therapies to treat glioblastoma.
I think that if I had to boil it down to one word, it's that it's hope. It's being able to know that whatever money is being raised is going towards a cause that I wholeheartedly back.
To give hope to people who have glioblastoma. It's a devastating disease. It's my hope, and the reason I'm doing this is so life can be extended.
We're getting closer and closer.
So impressed and remain so impressed with what Swedish is doing. It's not just disease, of course, that's what their research is doing, but that's why the walk and the support group are so important. That goes beyond just the disease itself.
This has been so inspirational, hearing all these stories. I just can't thank you all enough. I'm so excited to walk with you. I want to give a special thanks to Dwell Mortgage and Shane Kidwell and his team, Dwell Strong. We appreciate all you do for this cause and our community as a whole. Thank you very much. We are eternally grateful for the Ivy Foundation, in particular Ben and Catherine Ivy, for launching this incredible comprehensive center and research program. We would not be where we are today without you. Thank you so much. I'd like to recognize Swedish. Swedish's support of the Seattle Brain Cancer Walk ensures that every penny of your donations will be directed to support vital research to improve survival rates and make progress toward a cure for brain cancer. And just for all the individual donors and teams that have come out and supported us this year, I really appreciate it. I think it's going to be a great year for us and looking forward to very exciting work in the future. So thanks again for everything. But enough talk, let's get walking right now. Thank you so much.